Your Excellency, on behalf of the county governments, I take this opportunity to express our gratitude for inviting us to participate in this conference. We appreciate your continued leadership over the last 6 months. The protocols and guidelines developed since the first case was confirmed in the country have been useful in enabling the counties to confront the virus and reduce the infection rate. Kenya's efforts, as you are aware, has been recognized globally, and we congratulate you for your leadership. Today's conference is integral in the Kenya's COVID-19 journey. As we have heard from most speakers who are here during the panel discussions, has enabled the participants to reflect on the measures that both levels of government put in place to combat the pandemic. The speakers also reflected on the efficacy of the intervention, their effectiveness, and made proposals for socio-economic structures and systems need to anchor resilience and sustainability for future infections. Over the last 6 months, county governments in tackling the prevention, control, and management of the pandemic have learned a number of lessons from what worked and what did not work, and the challenges that still confront us. One key lesson, as I had said before, is that it is time, in times of crisis, we have no choice but to stick together. The pandemic brought the two levels of government closer, and this should be the way to relate always. We cannot wish away disagreements, but this does not mean we cannot sit together and agree to disagree, but still talk and find ways to serve the Kenyan people. The various national and county government coordinating committees were a good platform of engagement. We need to see more of this. As at the onset, during the disease, the county government had various gaps in key areas. For example, they had as little or no local capacity to produce PPEs. But today, there are counties who are undertaking local production of PPEs with the policy of Buy Kenya, Build Kenya. In March 2020, county governments had 56,328 health workers. Now they have 66,935, an increase of about 10,000. In March, county government in total had 162 ICU beds. Now they have 492. In March, our capacity to respond to emergencies had not been tested, but we now know that we can build in a record 19 days a facility to host 35 beds, fully equipped, as it happened in Murang'a. Your Excellency, the Council of Governors is documenting the county government story and journey about COVID-19, a publication that will be a must read for purposes of handling any future crisis. And thank you very much, Your Excellency, for giving us your forward for that document. The COVID pandemic crisis was in many ways a shock, which after a period of astonishment has caused an awakening to the inadequacies in the Kenyan society, but also to the opportunities available that you have not been paying attention to. Your Excellency, in conclusion, let me pose some questions that I believe we should continue to reflect on even after listening to the various speakers, especially after post-COVID period. The first question, what is the new post-COVID normality we are moving towards? The second question, what are the pitfalls that we should be aware of? I thank you very much. That's a statement from the Council of Governors.